No, we're ready to go.
Welcome to discussion session for Tuesday, September 9th, 2025. Keith, you want to jump in with the meeting agenda?
Yes. Mr. President, tonight's agenda, we will have the consideration for the award of a priority repair to a culvert located in the Public Works Yard. We heard about that at the last meeting in Gateway. Also, the consideration to execute an agreement with WPVH LLC, Michael Zemias Interest Limited, for 18 parking spaces on Washington Road. Consideration for the award of a contract to provide professional services related to the update of the zoning and Saldo subdivision and land development ordinances. Ian will cover that during discussion session, and also the consideration for the commencement of pension benefits.
Thank you very much. We will jump in, start with the EMS report.
There's Fred.
Good evening.
Good evening, Fred.
Thank you all for having us. I have Chad Primo here with me, who was part of the consultancy as well. We have some slides to go through. Thank you to the commission and the members of the audience. We've finalized the report that is with Keith and the commission at this time. Unsure what their process is for next steps there, but they have all of the final product that we have promised them throughout everything. Just a quick review of the objectives of the project. We kind of had four major points to look at. First being looking at the financial assessment, or conducting a financial assessment of MRTSA, seeing if we could do any benchmarking against state or national best practices, and then provide recommendations and implementation plan. Look at the operational performance from times and benchmarking and all of those items, any opportunities or options for enhancement, discuss any alternative system models or options out there that could be used locally or regionally, and then really how does the municipality and the EMS system, how do they work together? Is there a different option or opportunity to consider, and identify any challenges or benefits that may be there? When we kicked off the study, we sent an information data request over to Keith, and then we had great help with that from the MRTSA executive director and the chief and many members there. It was great to get tons of information. It always makes our consultancy so much easier when we get a large volume of information as opposed to small snippets. So just a quick shout out and thank you to everybody that did comply and just really get us all the information. And when we had a need or an ask, it was almost instantaneous that we got that information. So thank you. We came out twice, conducted some site visits, met with stakeholders, met with members of the authority, met with Keith and Ian regularly, just about every other week, and then met with various people at MRTSA, both remotely and in person as well. One piece we had discussed previously when I was there in person is that we had a little bit of an issue getting some solid data out of the 911 center. Sounded like that wasn't something new to be heard, but that did give us a little bit of pause in some of the data reporting that we did. We did verify and vet all of that as best we could with the data that we had, but we did produce a usable data report. At Fitch, we traditionally just kind of like to put everything right up front and then talk through it. So you'll see here are 7 boxes, and we essentially lumped or consolidated all of the work that we did into 7 critical findings. We use the word critical doesn't necessarily mean bad. It just means that these are findings that we found to be critical and require attention, maybe just recommendation, or things that may be challenges through the future. I'm not going to read all of them, but everything that we've talked through from the financial pieces, and this really did fit very well into the objectives of the study. We'll cover all of these individually throughout the rest. Just some brief snippets of data. You'll see the graph on the side here has total incident volume. We do know that this may vary a little bit from what MRTSA has. This is the data that we did get from the 911 center. So we see that in 2024, MRTSA in totality responded to 10,691 calls, and that's the information from the 911 center. There could be a variable that MRTSA says maybe we responded to more, but we didn't break down using any of their data elements. We use the data elements specific from the 911 center. The map that looks like a Christmas tree a little bit over there is, you'll see the partner municipalities outlined in black there. And essentially what this shows is incident call volume in quarter kilometer increments. And that's because our GIS analyst is from Canada. And anything that is in red indicates that there are calls occurring in that quarter kilometer, and then each adjoining space in a consecutive manner that shows the higher volume is obviously in red, the lower call volume that doesn't occur more regularly is out in the green areas. But essentially what this shows is, except for maybe this little area up here in Greentree, essentially all of the territory that MRTSA covers within the partner municipalities has a very high density for call volume. Then broke out over a 3-year period of 2022 to 2024, incidents by day of week, by year, and then by hour of day by year, which is, don't see any abnormal trends here when it comes to national benchmarking in any way. Many people always think Friday, Saturday, and Sunday are the busiest days. I still today can't figure out, but traditionally it's Mondays or Tuesdays that tend to be the busiest days. And that really holds fairly true here for 2024, with Monday being the busiest day and Friday following closely behind. Very normal trending here on the hour by day, as we see in bedroom community or mixed community, where we see as people go to sleep and such, we see call volume turn down. And then as people begin to wake up and begin to move about the day, we see that call volume increase. We also see the same when it comes to areas that have high volumes of nursing homes or those types of facilities where doctors come in and begin to see patients or do those types of things, where we see that call volume really steadily increase after the 9 a.m. hour. And that is fairly consistent throughout the years reviewed here. Just one thing of note, and would be consideration for MRTSA, and we'll talk about this towards the end, but maybe adjusting some shift hours or overlapping some shifts. As you can see, the call volume really stays very steady up until about that 8, 9 o'clock hour. So maybe some overlapping of shifts may provide some help there. We also, anytime we look at call volume, we try to provide some type of, everybody asks, well, what do you think our call volume is going to be in 3, 5, 10 years? Unfortunately, there's no master formula out there that allows us to understand what that looks like. But what we did is, historically, we went back and looked at the data, and over the 3 years of data that we had, there was about a 2.9% growth year over year. And then, so we then analyzed that and looked at the compounded growth and said, if at the current 2.9%, that's the yellow line, realistically speaking, by 2034, 2035, we should see almost 15,000 calls. If we're a little conservative, we're down around the 13,500 calls. And if we're a little aggressive at 3.5%, we're almost at 16,000 calls. Steady trajectory. We see that this is not an abnormal line that we see nationally or locally. And that percentage growth a little on the slower side than we see in some other communities. Some communities, working with a community to the north of Pittsburgh, their growth is projected at about 4% right now. So just a little variable there. we look at response time, and this is why getting the 911 data when somebody calls 911 and that
I'm
computer
sorry,
aided.
can we back up a sec? I have a question.
Yes,
So-
sir. I'm sorry, I can't see who's talking, but go ahead.
So if we have a relatively stable population, which we have, right? We have a relatively stable number. The demographics don't shift incredibly, right? It's not like one year the average age is 35 and the next year the average age is 85, right? So what would be the cause of call volumes increasing that much? So I know a couple of years ago, we told people, just call 911, it's not for emergencies, right? So I don't know if we're talking about MRTSA responses, like actual ambulance responses, or just 911 calls. So that's a question I have for some of this. But second to that would be, if we have a relatively stable population, and that's borne out by census data or even closer tax data, right? And we know roughly the demographics of the people that are here, what would cause an increase of call numbers like that? Would that be shifting age? You know, like when someone goes from 40 to 50 to 60 to 70 to 80 years old, it's generally accepted that they might need more health care, or there might be things that would trigger higher call incidents. I'm just wondering, what are some of those things that might account for that kind of increase in a relatively stable population with a stable age?
I'll
Sure.
throw that one to Fred.
Accidents, you know what I mean?
Yep, I'll tackle that as kind of quickly as I can. I think you actually answered some of your question within your question, which is obviously as people age, their need for EMS services increase. We also understand that many people use EMS and hospital care as their primary care, and that increases as we find insurance and insurers become harder to access and healthcare becomes harder to access, where people call, to schedule an appointment and they say, well, our next available appointment is April 2026. So we see that is a national trend we see. But again, there is no predictor there's no formula, let me say it that way. There's no formula of when the next 911 call will occur. So these are all projected based off of historical data. And we're just seeing that as over the last 3 years, we've seen this. But I know that I'm not specifically answering your question. I think specifically we would be looking at, accidents, those types of things, and then access to healthcare and an aging population would contribute to the increased call volume.
Fred, I'm going to ask a question because I am by no means an expert.
Yes, sir.
Does I'll say increase in incidences of drug overdoses also contribute to that call volume increase at all?
I can't speak specifically for your communities. I personally feel like we have, as an EMS system, have kind of leveled out on the drug overdose. I'm not saying that there are any less than what there currently are, but we also don't know what new drugs are going to come out. And, we're seeing Tranq and all of these new drugs come out where they're just ravaging people who have been previously addicted to heroin and those types of things. That traditionally moves, across the state one way or the other. And so I think that could add to it. I still think the primary potential increase for volume is the easy access to regular healthcare.
Thank you.
Yes, sir. So we looked at response time intervals, and this would be the information that was very specific that we wanted to get out of the computer-aided dispatch system at the Allegheny County 911 Center. So we look at call response or response time intervals in many different snippets of time. One of the hindrances we had here was we weren't able to necessarily capture all of those times. So we traditionally begin to look at a EMS response from the time that the 911 operator answers the call, and we call that kind of the hello time, until the time that the ambulance is dispatched, and then till the time that the ambulance is en route, ambulance is on location and such. So we weren't successful in necessarily grabbing solid regular information on that front piece. But we know that on average, so all of the incidents that we got information for, on average, it takes MRTSA 1 minute and 31 seconds to respond to a call after they've been dispatched. I would say that's phenomenal. 90 seconds on average, day, night, etc. Great response. On average, it takes them 10 minutes and 19 seconds from the time they respond until the time they get on location to an incident. Again, for the community, not being able to break down emergency response versus non-emergency response because the 911 center doesn't track that. On average, I would say that standard, that is an absolutely well on par standard for the community. So looking at a total response time, which is from the time the ambulance leaves the building until the time the ambulance, from the time the ambulance receives the call until the time the ambulance gets on location, 11 minutes and 52 seconds. For your communities, the Commission on Fire Accreditation International, which we kind of follow along with the National Fire Protection Association, they provide some response time standards. For your community, we should see about a 9-minute response time as the national benchmark. So just about 3 minutes more, but by the national benchmark. But again, the national benchmark does not look at emergency versus non-emergency response. And we did not do the same. I don't live in your community, but the couple times I was through there, I think it might have taken me 9 minutes to get from point A to point B, and that was a couple blocks. So I think that on average, you're on par for what we were looking for. Average travel time to the emergency room, just shy of 16 minutes. What was very interesting was we're seeing a rather significant amount of time from the ambulance arrival at the hospital until the time that they clear the hospital. And then for a total call time of about an hour and 5 minutes. Obviously understanding, and I heard this very loudly and clearly when we were there, not all of the patients go to the local hospital, which is in Mount Lebanon. Many of them go down into the city. Many of them, asked to go to farther locations. And that is if, it was a turn and burn kind of system where, ambulance A picked the patient up, drove him over to the hospital in Mount Lebanon, dropped him off and went back out on another call. You're probably looking at 30, 35 minutes for a total trip time. So what are some of those contributing factors that cause the increased time? Obviously the hospital offload time, traffic. The one piece where we talked about distance from remote stations is there's no active, what we would call system status management or movement of ambulances. So if multiple ambulances from the headquarters station are out and one of the two outlying stations aren't out on calls, and they're now required to kind of come into the central part of the district, that can cause more time. So an option would be to consider maybe moving some ambulances, but then that increases that expense of driving ambulances when they may not necessarily need to be driven. The other piece, which we talked about, was call stacking. And so that definitely impacts the call time because they enter the call and then however long the crews determine that this is a non-emergent low acuity call and we've got other more important or high acuity calls, that timer continues to run within the 911 system. So there are some call times that are 2+, 3+ hours that skew some of that response time data because of the way that it's tracked within the 911 system. So just want to make sure that we clarify all of that there when it comes to response times. But in totality, I would say for your area and the congestion and traffic and all of that, about 11-minute response time with the pieces that we talked about is okay. Now, the policymakers for each community could say they're not okay with that response time. But then obviously something needs to change. So that's expected performance versus demand and how those two pieces meet. We then looked at where the current stations are located and took that 9-minute drive time that is recommended by the Commission on Fire Accreditation International, and then said, okay, where can we capture the most calls that would occur historically? So with the headquarter station, Mertz's headquarter station being right here in the middle, at 82.5% of the time, they could capture every call that would occur within 9 minutes that you see in that green area. We then, with the goal of capturing 90% of all historical call volume, then see that the Whitehall station adds about 11% of additional capture. So that's the dark green and the green area. And then the Green Tree station takes that well over the 90 percentile. And you can see obviously where that's located, they actually capture more call volume would capture more or be available more north of where they are located, which is what that yellow area indicates there. We do this for all of our consultancies. So we just show, and if the commission came through and said, hey, can you show us what 5 minutes look like, what 8 minutes look like, what 15 minutes looks like, we can produce all of that, but based off of the community size and all of that. We then say, in a perfect world, if you could drop stations to capture the most call volume, where would you do that? So we've labeled these because we don't actually know where these, I mean, I can pinpoint them on a map, but I don't know if it's, the gas station or Mr. and Mrs. Jones's house, but from our optimized GIS modeling software, we came through and said, if you were able to put stations in these, in these two locations, you would capture 93.5% of the call volume, and you would essentially capture almost the entire area minus this little area down here on the bottom right of the map. Why is that important? It's important in that if MRTSA was looking to evaluate some station locations for the future, this would be helpful in them designing where they might think about placing stations for the future. So into the critical findings. We talked a lot about revenue cycle, and that is billing and the monies collected from billing. I know that there's a lot on the slide here, and I'll break it all down for you. So one of the biggest things that we found was an anomaly, was that when we looked at insurance, all of the insurance breakdowns from Medicare, Medicare HMO, Medicaid, Medicaid, private pay, commercial insurance, and all of those, we found that about 20% of revenue or of the collectible is actually in what we call private pay, which means there's a lack of information or there's a lack of insurance that is not captured, that the billing company is not able to actually bill the patient's insurance, or maybe they don't have insurance, but that the patient is responsible for paying their bill in totality because there's, again, either a lack of information or a lack of insurance. Or some of this falls into those that would have high copay, high deductible, or something like that. Traditionally, nationally, we see that around 7 to 10%, and 10% being the max. So we're double what the national average is when we see private pay. The other interesting was that the charge master, or what you see in the graph here, on this side is what MRTSA is currently charging for those types of calls. So from mileage, the ones in red, MRTSA does not utilize those codes to bill, or they don't provide those types of services. So an ALS1, an ALS2, a BLS emergency, and then these codes down here, which we don't traditionally work with adjusting. But so Again, on a national average, these rates are on the lower end of what we see to be a benchmark. In speaking with Doug DeForest and such, when we were working through some of this, and we do know that now MRTSA has changed billing companies, so we don't actually, at the time of this presentation, we don't have a new, what we call net revenue per trip. So we take all of the patients that were transported, all of the money collected, we divide those and come up with a number that we use to say, okay, for every trip, you're collecting about X. So based off of the data from the old billing company, they were collecting about $475. So if you see these numbers here, they're not even close, right? The net cash per trip or net revenue per trip is not even close what is billed. Easily with some adjustments and such, that number could easily be adjusted to $650 or $700 net cash per trip through a couple different ways. So one would be, this would not even include adjusting the rates, just simply adjusting, number one being decreasing the private pay and investigating why the private pay is so high, whether that's inability to capture patient information, not getting signatures, not getting social security numbers, not getting appropriate information, whether the billing company is not able to access some of that information. We know that based off of the information provided, it's not a Medicaid issue or people that are underinsured. We sometimes see higher private pay when we see a higher Medicaid number, but your Medicaid is, I believe, less than 0.5% for your communities. The other really interesting piece that we found is that, again, due to some billing issues, MRTSA had to write off about $1.5 million of bad debt in 2024. That's a significant number to swallow by any business, and that definitely impacted MRTSA and their bottom line moving forward to today. So on the side of the screen here, where we have all of the different colors, Fitch traditionally recommends that we look at billing rates to be anywhere between 300 and 350% of what is known as the Medicare allowable billing rate. So I didn't provide all of the behind the scenes work, but as you'll see here, we have the rates that would be at the 300% and rates that would be on the 350%. And you could see the differences here and the potential for additional revenue with some adjustments to the charge master. Now, just because you increase your rates does not mean that you automatically collect more money, right? Medicare and Medicaid are fixed rates and you're not collecting any more money there. Where you are collecting more money is from the commercial insurers, the UPMCs, the Blue Crosses, the Aetnas, the US Healthcares, because traditionally those will pay closer to the full rate that is billed. So there is, just in summary here, so there is definitely some opportunity for some internal billing and revenue cycle adjustments that really could positively impact the bottom line for MRTSA. So we talked about some financial sustainabilities, and you'll see some crossover here from the revenue cycle. But really, we heard from many that there's concern about the long-term financial sustainability of MRTSA and how does MRTSA move through the next 1, 3, 5, 7 years. And that, that kind of moves through, there's expenses are continuing to increase, and the revenue has actually been very flat and even slightly decreased a little bit from billing. So there needs to be a way to work through some of the items on the previous slide so that that revenue can be increased by just working through some of those billing challenges. Again, caveat, we don't know what the new billing company is actually doing for MRTSA yet. So I can tell you that they're one of the 2 kind of best in the nation that MRTSA selected. So I would assume that you would see a positive revenue turn once Digitech gets in and really starts working those claims and such. Not to reiterate the 1.5 million in bad debt, but that obviously impacted every piece of the bottom line of MRTSA. As is everywhere, there's increasing fringe benefits, salaries, insurance premiums are, doubling, tripling sometimes, and we need to make sure that our staff are cared for, are paid adequately, because the last thing we need is staff to leave agency A and go to agency B. And we need to make sure that they're being provided with adequate benefits. Some things to consider quickly. Maybe there's some cooperative purchasing that could occur with benefits. Maybe there's some opportunities for them to partner with one of the partner municipalities to figure out ways to decrease some benefit rates and such. We see that happen. One of the other big pieces is consideration of purchasing some kind of off the line or stock ambulances, or remounting ambulances, where you send the ambulance into the factory, they take the box off, they put a new chassis on, they kind of do everything. And you see many agencies save anywhere between, you can see 50 to maybe 100,000 in savings, depending on what's occurring. The 100,000 is probably very high. But the unfortunate part is we are seeing the price of some ambulances cost anywhere between $300,000 and $400,000 now for ambulances that have that may be larger, that may have some extra amenities or options. So maybe something to consider is something more middle of the road. The other piece would be the establishment of a funding committee to really work through each one of these financial sustainability options and opportunities. And that would be a group of the MRTSA Authority Board that would then be holding kind of all of those finances accountable. Our recommendation would be that, obviously made up with the MRTSA Board, the Director of EMS, and the municipal managers, because they're the ones who are empowered by the elected officials to be making those day-to-day decisions, options, and all of those pieces. You see three kind of common themes here. Again, we're still talking about the spending, but we broke it down into operational and what are some of those cost pressures we're seeing. Again, increasing salaries. We understand that MRTSA has a CBA. Doesn't matter whether they do or do not. Salaries are increasing across the board, across the nation. And if we're not seeing salary increases occur, we're seeing agencies truly suffer and not being able to retain high quality personnel like MRTSA has. So there is a direct connection to ensuring high quality personnel by paying them adequately to make sure that they stay with the organization. We talked about the capital purchases. There's been many that have occurred recently with new ambulances, new heart monitors, power stretchers, and all of these things are important and really needed, because ultimately it does come down to patient safety, what's the best for the patient, and then making sure that the employees are safe, because the last thing we want to do is kind of cheap out on some equipment and then have a bunch of employee injuries that negatively impacts the organization. So looking through all of this, and MRTSA does have all of these kind of employee safety and patient safety options, but those are some of the reasons why we're seeing some operational cost pressures. Probably an opportunity to consider some additional transparency and prioritization of how purchasing occurs and what a need is, and does it need to happen today, tomorrow, and engaging with the municipal leaders, the staff definitely have interest in understanding what's happening in their organization, and even the public, right? Because it's a municipal authority board, and the public may have interest in understanding where their money is going and what it's paying for. And then really working through a kind of line-by-line budget review process where you're inviting the appropriate and right people to the table. So again, the municipal managers are empowered by the elected officials to do that day-to-day operation. And if they're not at the table, then they might not be able to provide adequate information to the elected officials. And then making sure that the right internal leadership at MRTSA is again at the table, making sure that the right budgetary items are being reviewed and approved or not approved. And if not approved, then what does that cycle or schedule look like? There's definitely some challenges within the governance model of the authority, and that happens. We see this in many EMS authorities that have been around for a while, that there's some challenges, right? Many of the authorities were established back in the 70s and were established under the Pennsylvania Municipal Authorities Act, which again doesn't specifically state EMS can be an authority, but doesn't say that it can't. So there's always that little bit of question out there of authority and yes, no, and how that all works. But I think just 2 points to talk about. One is making sure that the bylaws of the authority really emphasize strategy and innovation over procedural compliance. And in the bylaws, there's lots of procedural compliance type items. So really taking those bylaws and bringing them up to 2025 and looking at, yes, there needs to be compliance to certain items and all of that, but really looking at strategizing and innovating for the future to keep the authority moving forward as we go. And then there's no performance accountability mechanism for board representatives. So what's expected of a board member of the authority, other than attendance, right? But is there an expectation? Should there be an expectation? And then should that be outlined in the authority bylaws? We would suggest that there is some type of expectation put in there. And again, just some basic outlines, and there's more in the report that highlights that. Sorry.
Hey, Fred, just a quick note. We're coming up on the scheduled time we have for this.
Yep.
We've got about 2 minutes left. Can you kind of wrap up a summary here for us at the end?
I can.
Great.
So, pathway forward. We don't recommend 2 or 3. I'll cut to the chase there. So option 2 would be that it merges with the fire, EMS merges with the fire department. That would be a huge undertaking. Don't recommend it, but it's there as an option to consider. Option 3 would be to contract with a private provider. You make an RFP, you put it out there, and you go through it. For your community, I don't know that there would be a private provider that would be beneficial to bid on it, and you would absolutely probably lose the majority of your staff that are well committed to your community. So again, we don't recommend it. The 2 biggest points I want to hit home. Number 1, there should be an agreement between the authority and all of the municipalities, performance expectation, response times, and what those equate to, right? So you do this, we provide this. The other piece would be the consideration of some type of dedicated EMS fee model or dedicated EMS millage, like many of the surrounding authorities are currently doing. Ross Westview, where it's a per household fee that is then providing, everybody's paying that fee to have EMS. That then takes the municipal contributions down as that ramps up, and that really provides some solid sustainability. The other big recommendation we have is clarify the roles within MRTSA. There's some confusion between all of the leaders. They need some more supervisors, and we would absolutely recommend a CFO. I think I got it under 2 minutes.
Perfect. Thank you. Appreciate it.
So I just want to reiterate one of your sentences for the group, and that is that the preferred option is to maintain and modernize the current authority-based model through a series of targeted reforms.
Yes, ma'am. 100%.
Thank you.
Yes, ma'am. Thank you all. I appreciate the opportunity to present tonight, and I'm available. Keith, you know how to get a hold of me.
I do.
Thank you all.
So internally, we need to continue going through it and talk about, yeah.
I think we have to decide whether we're going to accept it or not, because it needs to go to the MRTSA board, and it needs to be distributed to the different MRTSA folks.
Correct. So if this commission, again, is, I'll say satisfied with the report, then I would say it would be Ann and Steve as our commission liaisons to MERS that would then move it forward with the board, and providing all of the information that you've seen here tonight that the commission has to that board, and then letting them discuss how to utilize the recommendations in the study.
Sounds good to me. I'm satisfied with the report.
You're okay with it too?
Yeah.
Okay, good. All right, then we can release it and make it public knowledge to the board.
You want to move to the next item?
Yes, thank you. Zoning saldo update.
Thank you, commissioners.
Great, I get a chair, sorry. I thought I was gonna have to be up there, this is great.
Thank you, commissioners. We're here to provide an update on one of the major projects that was funded as part of the 2025 budget, which is the update to our zoning ordinance and subdivision and land development ordinance. As we all know, this is kind of the compendium piece of the comprehensive plan. We approved the comp plan in January of 2024, and an update to zoning and saldo is a typical follow-up to any comprehensive plan. So we issued an RFP that was reviewed by the planning board back in August. We had 5 very qualified firms submit proposals. The planning board, along with myself and Commissioner Siegler, reviewed those proposals. We identified 3 firms that we wanted to interview. We had an interview panel an interview panel consisting of Commissioner Swager Wilson, along with 2 planning board members and myself. And the panel is recommending that we contract with OHM Advisors to conduct the project. So we have some folks from OHM along with their subcontractors here tonight. They have a short presentation that they'll run through, and then there's an item on tonight's agenda for the approval of the contract. So with that, I will turn it over to RJ.
Oh, okay, I get to drive and everything, this is fun.
Arrow Quiche.
Okay, let's see if I can remember how to do this from last week. So, thank you for having us here this evening. We were delighted to meet some of you on the interview committee last week, and we're delighted to be back. Arrow keys don't work. Thank you. We're just gonna run through some introductions really quick. My name is RJ Susko. I am Senior Planner and the Project Coordinator for our Pittsburgh office. Joined the OHM crew back in the spring, coming from about 10 years of local government experience prior in municipal management and planning roles. And we also have our principal from the Pittsburgh office, Chris Riggert, who I believe would like to introduce himself on the
Yeah, good evening, everyone. Apologies, I'm not there this evening. As RJ said, I'm the director of our operations here in Western Pennsylvania and the principal in this project. And like RJ, speak for the whole team and how thrilled we are to be working with you. I am here in a supporting role to answer any questions that may come up, and you're in good hands with RJ.
We also have, not here this evening, but part of our team bringing the heat from the Columbus office, Adam Cook. He is an excellent housing, economic development, community development specialist, zoning, placemaking, all the good stuff that goes with projects like this. And you will be hearing a little more from our other 2 team members, but just to keep us rolling here, we have Carolyn Ristow from Details Reviewed, our code writer extraordinaire, as well as Breen Masiotra on the Zoom from Evolve EA. She is our mobility specialist on this plan, an excellent urban planner. You will hear more, like I said, from them in a moment, but just to get you oriented to who OHM is. So we started in the 60s in Michigan as a little engineering shop, and we have grown quite a bit since then, as you can see, 26 locations throughout the Midwest, as well as a couple down south. Over 850 experts of diverse backgrounds and 11 collaborative disciplines. So whether it's municipal engineering, architecture, urban design, zoning codes, there's probably somebody in a river out there in Ohio doing a muscle survey somewhere. We have a little bit of everything. Our mission ultimately has been the same from the beginning, advancing communities, whatever the clients that we work with, the communities that we serve need, we bring it together. And I will pass it off to Carolyn and then Breen.
Thank you. I will reiterate that we're very excited to be here. I am the founder of Details Reviewed LLC. It's a boutique zoning consulting firm. I take a 3-tiered approach. First is research to understand what zoning regulations are, how they came about, what were the original motivations, so that we can critically understand why we have the regulations we have today and make better decisions about which ones we want to continue in future and which ones we need to change. The second tier is education. It's very important to make sure that people understand what zoning is, what it does, and how it impacts our communities. And then the third tier is the practice, which is what we're all here for today, bringing the education and the research to inform how we're going to move forward to make a zoning ordinance for Mount Lebanon that is usable, understandable, and is going to supply the regulations you need to meet the goals that you have for today and the future. And I'll pass it off to Breen to give a little intro on Evolve.
Hello, I'm Breen Masiotra. I'm a senior project manager and mobility planner at Evolve Environment Architecture. We are a small but growing woman-owned firm at the intersection of design, sustainability, and the built environment. We have some great history with Mount Lebanon that we're excited to build on, working on the planning phase of the Uptown project. And also, I'm happy to be back working with you after supporting Pashek on the comprehensive plan. My background is in transit-oriented development a little bit, working with Mount Lebanon in my prior role at Pittsburgh Regional Transit. So I'm looking to bring that expertise and pull forward the zoning toolbox we did at that time into this project. Thanks.
Awesome, thanks guys. So something that I want to emphasize before we move on to the approach overall is while we're all pretty thrilled to be working on this project, ultimately, this is your project, this is your community, we're here to be your partners. But what the community needs is what's driving the bus. We're just here to help you guide it down the roadmap to success. So again, just a few things that we want to pull forward that we believe are keys to the approach on this project. First of all, multidisciplinary and holistic team. As I mentioned before, we've got kind of everything under one roof. So when it comes to visioning, the early stages of planning in those projects to actually getting things in the ground, we've done a little bit of everything. And we're happy to continue to help the communities that are really the leaders in their region. And I would say that Mount Lebanon fits right into that list to continue to elevate the conversation and deliver results for your communities. Design that endures, something that really is a keystone no matter what project our team is doing is excellence in design. And that means people-centered solutions that are grounded in those national best practices from all of the different geographies that we do work within, but being able to bring that home, ground that locally, and make sure that those solutions are right-sized for what your community needs. It's not an out-of-the-box solution, it's tailored with grounding. And that also is supported by many of our team members of public sector foundations. That is in fact an action shot of Carolyn when she was working the City of Pittsburgh zoning counter once upon a time. Look, we've seen the good and we've also seen the bad of administering a code. We've been there, and so this code has to work for several different end users. One of them, of course, being residents, but another being staff. And so having a good code is a way that you can really gain efficiency and reduce friction between the public and not feeling like they're interacting so much with the capital G government, so much as an actual human being. The foundation to that is having a good ordinance in the first place. But on the other hand, we've also done work with the private sector. We understand what that looks like from the development end when you're trying to use a code to get to something that is good for the community. I like to say that a good ordinance is kind of a bat signal to draw in the developers that meet your community's vision that can also be partners with you. And again, a whole reboot required. There was some developer out there that really wanted to respond to the bat signal. But look, bad code, the development that it attracts, they know it's going to be miserable no matter where they go. But having something that makes the process, again, reduce friction and understanding what that looks like from the ground up, that's something that we can provide with our team as well. And wrapped all into that is something that we heard that was very important during the proposal process, was making sure that we're connecting with the community, educating, using first-class tools to really get the message out there and help bring people in. Something that I've always said, from my public practice until now, is the way that a document is structured, any document when it comes to the government, tells people who it's for, who is supposed to be a part of that conversation. And so if you have a code that's complex, convoluted, full of legalese, your residents are gonna look at that and say, I don't think that this conversation is for me. And that's something that we really couldn't be further from in, the way that we see this. This is something that we want to be able to convene and invite people in, not only because it makes a better project outcome, but also because it increases buy-in and there's a sense of responsibility for the success of what we do with this project. So I do want to talk a little bit more about some of the really cool tools and different technologies that we have to make that a reality. Our engagement toolbox, if you will. So one of the first places that we start is looking at how you already are engaging with your community, right? And Mount Lebanon has some really excellent channels, brand new shiny website, a really cool podcast, how-to videos, all kinds of things like that. And so it's great to start from a foundation of how your residents already expect to be engaged with. So we've built that into the plan. Another really key piece that I think was very important based on what we heard during the RFP process is making sure that we're doing internal engagement. So the stakeholders, the boards and the authorities, statutory appointees, the interface with the development review process, understand, what their roles and responsibilities are, what the process is, and we can work out any of those pain points in a workshop as the code is drafted to make sure that it is usable for them as well. I also do want to note that we will be coming to the planning board and the municipal commission at the end of each phase to check in and again, make sure we're still, rowing in the same direction. Interactive mapping tools that can integrate with your website. We can do some really neat stuff with ArcGIS. For example, just a before and after story map, if there are any zoning map changes desired. But also, after the lifespan of the project, once the ordinance is adopted, being able to create a zone lookup tool that allows people to put their address in and pull up information about permitting, how tall your fence can be, what you can do on your lot. Of course, the goal is to make the code very user-friendly, but again, another point where we can reduce friction is, just type in your address and you don't have to cross-reference the map with the code. We can tell you right here exactly what you need to know. And the last thing that I want to highlight, some really cool VR tools. That is a working QR code, so if you desire to pull out your phone and take it for a test drive, please feel free. This is the Lane Avenue Streetscape project from Upper Arlington, Ohio. As you can see on the left there is a charrette activity where we have the plan for the streetscape out on the table with that QR code. But also on the right, not only is it, a concept image that you can look at on your phone, we actually have these really neat cardboard goggles that you could just drop them into. And it's a really excellent way to sort of bridge the gap between the different ways that people understand information. For example, if you're like me and you think in a wall of text, you may not necessarily be able to look at a plan and get sort of the scale of what it would be like to be in those areas that are activated in the new code. And so that is something that we can do through our VR. I'm sure that, once we get to the Q&A portion, Chris is all over this. He'd be happy to tell you more about it if you have any questions. But with that, I will wrap up the keys to the approach for our roadmap to success and turn it over to Carolyn to tell you a little bit more about the work plan.
So we have proposed a 4-phase approach to this project. Phase 1 is the project launch. That's where we're going to really get grounded and rooted in Mount Lebanon and the great existing planning work that you guys have already done. We've taken a preliminary look at your plans and seen that there's a lot of really excellent recommendations and ideas that are going to inform the zoning ordinance that we are going to develop. So we want to get a good grounding in that. In phase 1, we will also be finalizing and fine-tuning what the engagement strategy is going to be. Which of the tools from our engagement toolbox are the ones that we are going to employ, and at what points in time are we going to incorporate those in the project. Phase 2 is my favorite part. It's the diagnose and draft part. This is when we're going to get into the real nitty-gritty about what your ordinance says, what things we want to keep, what things we need to change, and how we are going to frame the new ordinance. And ideally, we're going to come out with this ordinance that's going to use plain language, it's going to use graphics, it's going to be accessible, it's going to be understandable. And to make sure of that, we go into phase 3, which is the convene and calibrate. We then take the draft ordinance for a test run with the community, with the stakeholders, make sure that everything in it is working the way that it's intended, make sure that people understand it, and make sure that it's in alignment with the goals as we understood it from your prior projects. And then the final phase, phase 4, is the adoption phase. That's the really technical part of making sure that we cross all our T's and dot all our I's, make sure the counties had a chance to weigh in, make sure that the public has a chance to weigh in, make sure that the commissions and the boards have had a chance to weigh in, until we get to a really good, solid final document for both ordinances and take it through the adoption process.
So, thank you for joining us along this speed run. In the interest of being, respectful for your time, but yeah, we would be more than happy to take any questions, chat more about anything in the work plan. I think I speak for all of us when I say we can talk about this all day.
And all night.
And all night, and all night. Even at a zoning night out, that's an option in there. Carolyn and I will come in and teach a zoning seminar if you'd like. But no, seriously, thank you for having us here tonight. We look forward to hopefully working with you. And happy to take any questions.
I don't have any questions because I already talked to them. That's up to you guys. Come on.
I feel pretty good about it.
I would just say that as on a general note, and I'm sure that Ian's already communicated this to you, over the course of the last year to year and a half, we've had a variety of issues that have come up related to the zoning ordinance
Oh, yeah.
specifically. So Ian's been sort of keeping a running list of those issues
Oh, good, we love that.
to provide and share with you as a consultant, which will provide you with some areas of focus that, again, have been discussed preliminarily with, through the discussion sessions or through public sessions at the commission meetings, to hopefully give you a little bit of insight into some of the community concerns that we've heard related to zoning.
Yes, I'll just call out that that's actually a pretty key part of the launch of the work plan. Because you have such a good history and track record of existing planning efforts, as well as tracking those issues that keep coming up as pain points. One of our first tasks is to intentionally gather all of those together and map out how they're going to fold into the new ordinance. That's something that's an additional step we're taking because there's such a good foundation already.
Any other question? Nope. Okay.
Thank you.
Got you out early.
Yeah.
Thank you.
Thanks. Boards and authorities.
Welcome week, the library's having a welcome week, the third week of September, to welcome new residents, new groups into Mount Lebanon. They have a week's worth of activities planned. It is all on the Mount Lebanon Library website. WRTA meets the end of September. What else? That's it, CEB, nothing new.
Okay.
It's not, I was out of town during the last resiliency board meeting, but I understand they had a discussion on the golf course project. Keith, do you recall the name? What's the name for the project they're discussing over the golf course?
Golf course project.
The, looking at the community gardens,
Ongoing.
can't recall, but they had a discussion about that, about, planting some native trees and
Budget time's coming.
Yeah. Got a little feedback on that, and that looked good. And then a resident came in and presented on gas-powered lawn equipment and just presented some data on that, and looked pretty interesting as well. So there'll be a further discussion about that at the next meeting.
Cool. School board, I attended the PTA council meeting with Dr. Freeze, some of the staff, administration, and all the PTA councils, November 3rd, I guess, a week ago. Just listening to some of the updates of the members of the public, what the PTAs are talking about. There is an effort, well, out of the strategic plan that the school did, Dr. Freeze reviewed at the last meeting for all the PTAs and members of the public, some of the areas that the school administration want to focus on moving forward, which was all listed on the school district's website, in addition to the strategic plan that they have listed, approved, gone through many meetings with the public, so all that's available. There was some conversation about financial updates. some reassessments, things like that. The school's in a much better position. There was a conversation about some outstanding court cases related to assessments and money issues. And those were mostly resolved, which was a benefit to the school also. Also, they are talking about Lebo ID, so anybody that wants to get a Lebo ID, it's kind of like your digital passport for the school, which gives you access to different items, resources, information. If you've got kids in the school, you can contact administrators, do other things through Lebo ID. It's kind of their digital unification, kind of, like I said, like an online passport for the school district. So people can go to the website and look up how to get access to that. So other than that, from our last update, school's now in session. So I think the last update was school's not in session. So slightly different update. And we have our new junior commissioner here starting
Yes.
today. So we'll
Yeah.
hear from Paige Jocks in a couple minutes at the commission meeting. I think that's it for school updates.
Yeah.
Yeah.
We have a few minutes before the regular meeting will start.
Yeah.
Is everybody ready?
5 minutes or so. Great. See everybody over there.